I want to bring in infectious disease specialist Dr. Isaac Bogoch this morning. Doctor, good morning. Nice to see you on this Friday. First of all, let's talk about this mouthwash test that we're seeing in BC. How does it work and how effective do you think it is?
Yeah, I think it's really great. First of all, that you just put a little bit of saline, it's salt water in the mouth, gargle, spit it into a cup, and that's the end of that. So it's pretty quick, it's pretty straightforward. You can do it without the help of a healthcare provider to do a swab. So I think it's fast, requires fewer resources, it's easy. I think it also lowers barriers to diagnostic testing, which I think is extremely helpful, especially now when we're hearing about long lineups. Is this going to solve all our problems? Absolutely not. But this is really a step in the right direction, and I think it's going to provide a lot of benefit for children. Hopefully it can be rolled out to adults as well and implemented across the country.
Okay, well, let's talk more about that. It is being marketed as something for kids because it's so easy to use. Does it have the same accuracy if adults do the swish as well?
I'm not entirely sure. I don't actually have access to the data, but certainly if it's comparable and if resources allow, I think this would be a very scalable solution. We also have to remember that, of course, kids don't want a swab stuck into the back of their nose, but neither do adults. And I think many adults would choose to do a saltwater rinse and spit rather than having a nasal swab in their nose. Now, I should also say that the nasal swab, the nasopharyngeal swab, not as bad as some people make it out to be, but certainly if given the option, I think lots of people would choose to do that swish and spit technique. And I think this will just lower some of the barriers to people getting a diagnostic test. It might bring more people out for testing who actually need to be tested.
All right, let's talk about what's going on in Ontario. As of midnight, the number of people who can gather has been rolled back because of climbing case numbers. And now we're starting to see some mayors from other towns saying, hey, we want this where we live too. We want to curtail whatever spike we're looking at. What are your thoughts?
Well, certainly I think it was a good move in Toronto, Peel, and Ottawa. That's what's driving a lot of the cases, or those are the locations driving a lot of the cases. And we know that some, not all, but some of these are related to house parties. So I think by limiting the number of people in social gatherings it's extremely important, and I think it will be very helpful. Of course, it's not going to be a perfect solution. Of course, it's not going to be a silver bullet. But I think if this is coupled with other measures to really keep the infection under control in the province, it's a helpful step.
Okay, and here's my daily question to you on the second wave. When we look at what's been going on across Canada, we look at the UK considering going back into some sort of lockdown. Israel is in a stay-at-home order for 3 weeks. Is there any doubt that we are now in the midst of the second wave?
No, I wouldn't say there's any doubt. We saw a real significant lull in cases in Canada over a couple of months during the summer, and now we're seeing a very significant and real rise in cases in 4 provinces. And this is it. I mean, this is what a second wave looks like. It doesn't mean it's going to be astronomically high. We just don't know how high it's going to get. And quite frankly, how this second wave plays out is completely dependent on us and completely dependent on what we do collectively over the next few weeks and few months ahead. I should also note that Eastern Canada isn't having any of this. They are doing phenomenally well, and the transmission in the Eastern Canada bubble is just like negligible.
Yeah, okay, but you think we are in the second wave, or it's starting at least?
Yeah, I mean, it's got a loose definition. It's not like there's specific criteria, although some epidemiologists are going to send me hate mail after this. But in all fairness, it's not the criteria for defining this aren't necessarily precise. Like we had a real lull in cases over time, and now cases are going up. I think we could say we can call it a second wave.
All right, Dr. Bogoch, have a great weekend. We'll talk to you again soon.